Presenting symptoms of neurofibromatosis include cafe au lait spots, which are pale tan or light brown discoloration. These may be present at birth or may appear over time, frequently increasing in size and number throughout childhood. Additionally, there could be freckling in axillary and inguinal regions. Such abnormalities of skin pigmentation are often evident by 1 year of age and tend to increase in size and number over time. Plexiform neurofibromas are evident at birth or early childhood in affected individuals and may have relatively large benign tumors that consist of bundles of nerves. Plexiform neurofibromas are more diffuse growth that can be locally invasive and quite deep, and they may be associated with bony erosion and pain. That will be the picture of the legs, and the plexiform neurofibromas are on the right leg. There could also be tumors of the optic nerve. On the second, cranial nerves, which transmit nerve impulses from the retina to the brain, can be affected. And then leash nodules, which are benign tumor-like nodules of colored regions or the iris of the eye. These do not cause medical problems and do not affect vision. Lastly, they could have macrocephaly and a relatively short stature. Subcutaneous or cutaneous neurofibromas are rarely seen in young children, but appear over time with older children, adolescents, and adults. Deep lesions may be detected only through palpation, whereas cutaneous lesions may appear initially as small papules on the trunk, extremities, scalp, or face. Puberty or pregnancy may be associated with an increased number of neurofibromas, as well as more rapid growth of pre-existing lesions. The picture on the top right is a 28-year-old male with cutaneous neurofibroma. Additionally, abnormalities may be present, such as episodes of uncontrolled electrical activity in the brain or seizures, learning disabilities, which occur in 50% of children, speech difficulties, and hyperactivity. Lastly, skeletal malformations may be present, including progressive curvature of the spine or scoliosis, bowing of the lower leg, and improper development of certain bones. In individuals with neurofibromatosis type 1, associated symptoms and findings may vary greatly in range and severity from case to case. Neurofibromatosis case scenario. Robert Smith, 13 years old, presents to the clinic. At first glance, Robert looks like a normal teenager. He reports that he struggles in math and science, but is passing. When asked about pain, he describes backache and difficulty extending arms completely. He says he often has to sit on the floor to feel comfortable. On physical exam, you find multiple cafe au lait spots over his torso, axillary freckling, and subcutaneous nodules on his extremities. Cafe au lait spots are flat round spots on the skin. They are harmless and are found in many people. More than 6 spots is a strong indicator of neurofibromatosis. They usually are present at birth or appear during the first year of life. They are not serious but can be a cosmetic concern. X-ray shows bilobed mass on Robert's spine, and an MRI reveals extensive plexiform neurofibromas throughout his spine, pelvis, and thighs. Neurofibromas are benign tumors that can be located anywhere in the body. Many people develop tumors in the skin or under the skin, but neurofibromas can also grow inside of the body. Sometimes the growth will involve multiple nerves and is then called a plexiform neurofibroma. Robert's mother states that she was diagnosed with neurofibromatosis 1 at the same age. Other symptoms of neurofibromatosis include 2 or more growths on the iris of the eye known as leash nodules, optic nerve glioma, which is a tumor on the optic nerve, and abnormal development of the fine synovium in the tibia, learning disabilities, and ADHD, which commonly occur with children with neurofibromatosis but are typically mild, and larger than normal head size and short stature. Three is NUR syndrome, which is cafe au lait spots, ocular hypertelorism, down slanting, palpebral fissures, low set ears, left neck, short stature, and congenital heart disease. Four is Leber syndrome, which is hypertelorism, sensorineural deafness, hypertrophic cardiomyopathy. 5 is routine Albright syndrome, which is cafe au lait spots, polyostatic fibrous dysplasia, and precocious puberty. 6 is Whipple-Triani-Weber syndrome, which is large cutaneous hemangioma with hypertrophy of the related bones and soft tissues. 7 is lipomatosis, which is trunk and limb multiple lipomas. And 8 is generalized fibromatosis, which is multiple nodules of fibrous tissue apparent before age of 2 years in muscle, bone, subcutaneous tissue, and viscera.
Neurofibromatosis type 1 is a very genetic disease, so genetic testing is very important for this. It can be done to figure out if there is a mutated gene in a family's history, which is important before making the decision to start a family and becoming pregnant. Some of these ways are with direct gene testing, gene linkage testing, and then testing before and during pregnancy to find out if the fetus has the mutated gene in their DNA. And this can be done through chorionic villus sampling and amniocentesis. Also, if there is a known history of the NF mutated gene, you can choose to do a pre-implantation genetic testing and figure out whether it's a good idea or that if you want to continue with the pregnancy. Unlike many diseases, there's not very many lab tests, or anything like that for this disease. X-rays and other imaging studies can be done to find out if there are tumors or the neurofibroblastomas, but it does not necessarily tell that if somebody has or does not have the disease. But after knowing that there is a possibility of the disease, you can't do a diagnostic biopsy sampling of a known tumor. And then after you realize that the diagnosis is true, then you can choose to do additional testing to monitor symptoms and possible complications. These include x-rays for make sure that the child's bones are going to develop right or are developing right at the time. MRI to detect tumors in soft tissue, and deeper and more internal than that as well. The biggest non-cancerous tumors that can be found with the MRIs are on the optic nerve, and that can tell if there's going to be vision problems, or if there is something that you can do to remove those to avoid vision problems. Also, hypertension is a very common complication from this disease, so blood pressure monitoring is important as well. Use of an EEG testing can monitor the affected individual for seizure activity. How can neurofibromatosis be diagnosed? that is a question that, as you can see with the slide, it is diagnosed when 2 or more of the symptoms listed here are present. These include 6 or more café-a-la spots, which is the most common sign. These spots are lighter pigmented spots that can also be mistaken for birthmarks, but the majority of patients with this disease have 6 or more of these spots on their body. There are 2 or more neurofibromas of any type 1 or 1 plexiform neurofibroma, freckling in the axillary, so under the armpit, or inguinal or groin areas, benign tumor of an optic nerve, also known as a glioma, 2 or more lesion nodules in the iris, lesions in the bone with or without pseudoarthrosis, and then also family history of neurofibromatosis type 1 is another good way to know if this is a possible diagnosis or not. And remember, only 2 or more of these symptoms need to be present for a pretty secure diagnosis of neurofibromatosis.